At UConn Health, we believe that every patient has the right to understand the risks, benefits, and alternatives for the treatments they receive. This is essential for making informed decisions about your care. Code status is one such treatment decision. It's similar to deciding whether to have surgery. It's important to understand the possible outcomes and how these choices align with your values and goals. We've created this video to help you better understand what code status means and how it might affect your care. The video contains a conversation between a doctor and a patient with chronic illness who has been in the hospital recently due to worsening of their chronic illness. By the end, we hope you'll feel empowered to make informed decisions about your treatment preferences.
Hello there, it's Dr. Ezel. How are you feeling today?
Much better, thank you.
I'm glad to see you're improving. As we start to plan your transition out of the hospital, I was hoping we could take a few moments to talk about your wishes if you're ever too sick to speak for yourself.
Is everything okay?
I can see you seem a bit surprised. This is something I try to do with all my patients. For starters, it's important to know who you want to make medical decisions about if you're ever unable to speak for yourself.
Oh, that would be my partner. We filled out some forms a while ago.
That's great. We should get copies of those forms. In the meantime, I can make a note in the medical record that your partner is your healthcare representative. Thank you. Have you and your partner talked about your thoughts about medical interventions if you're too sick to make your own choices?
Not in detail, but we've discussed that I don't want to be a vegetable.
Today I'd like to discuss one particular procedure. Before doing so, I want to make sure we have the same understanding about your current medical condition. What is your understanding of your medical condition?
Well, I know my body is getting weaker, and it's getting harder for me to do certain things like walk the dog. There's no easy fix, or else I wouldn't keep needing to come back here to the hospital. I guess I haven't thought too much about. Maybe you can fill me in.
I think you understand the big picture. You have an illness that cannot be cured, and it will progress over time, meaning you're expected to feel sicker over time.
Yes, I did realize that.
Since we know your disease will progress, it gives us the chance to plan ahead. As your condition changes and affects what you can do, it is really helpful for your medical team to know more about what matters most to you. Looking ahead, are there things you really want to do?
Well, we have a trip planned for next month. Since retiring, I've generally been looking forward to seeing my family more, as well as spending more time gardening and cooking.
I see you have much to look forward to. As your health changes, are there things that worry you?
Well, I haven't wanted to say anything, but I'm a bit worried about this upcoming trip. Usually my husband and I like to explore by walking, but I get so tired. More generally, I'm worried about having to rely on my family to take care of me. But I'm also worried about ending up in a nursing home, because I like living in my own home.
That makes a lot of sense. I hear that time with your family is really important. I also hear that you value your independence and the ability to live in your own home. Thank you for sharing that with me. With chronic illness, patients can sometimes get very sick rather suddenly. In those circumstances, the medical team needs to act quickly to make sure that we provide the kind of medical care that allows you to live the way you want to live. We should talk about invasive interventions, such as cardiopulmonary resuscitation, or CPR, and a breathing machine. Collectively, doctors refer to decisions about these procedures as code status.
Code status? What does that mean?
All patients admitted to the hospital are assigned a code status so that your healthcare team knows how to respond if your heart were to stop, or you were unable to breathe. Without prior discussion, all patients are considered full code. This means that if your heart stops, we will perform CPR and place you on a mechanical ventilator, or a breathing tube in a breathing machine in an attempt to restart your heart.
So, if I choose full code, you'll bring me back to life?
Unfortunately, probably not. The goal of CPR is to restart the heart, but it doesn't guarantee recovery to the life you had before. It's important to understand the possible consequences of restarting a heart in a body that is still very sick.
I guess I'm a little bit confused. Don't people just wake up and feel fine after CPR?
CPR is most effective in patients who are otherwise healthy and whose heart stopped due to a sudden change or emergency. Think of a patient whose heart stopped while having surgery. These patients have the best chances to make a meaningful recovery. Unfortunately, we know that CPR is less beneficial for patients who have other significant health issues.
What about someone like me? I have some health issues and I've been hospitalized a few times for them. Would CPR help me?
With multiple health issues causing hospitalizations, I worry that CPR would not help you. Older patients and patients with serious illnesses like lung disease, heart failure, or cancer are unlikely to survive CPR and more likely to have a worse quality of life if they do survive.
So that means if my heart stopped and you brought me back to life, I wouldn't be my same old regular self? That is really different than what I expected from seeing CPR on television.
That's right. Television does not accurately portray the likely outcomes of CPR. We know from research that only 1 in 6 patients who get CPR in the hospital survive to discharge, and those who do survive have a lower level of function.
So, what are the alternatives to CPR?
The alternate code status choice is DNR and DNI, which stands for Do Not Resuscitate and Do Not Intubate. This means that if your heart stops, which is a sign you are at the end of life, we would allow you to die naturally. We would make sure you were comfortable and not suffering, rather than perform CPR or put in a breathing tube and place you on a breathing machine.
Does choosing DNR mean you stop taking care of me? Is this the same as hospice?
I'm glad you asked. Not at all. DNR DNI is not hospice or end-of-life care and does not limit any other aspect of the medical care we provide. It is simply a limit put in place to avoid bringing you back to a quality of life that may not be pleasant or acceptable to you. It is about avoiding invasive treatments that are unlikely to help and focusing on care that aligns with your values and goals. Our goal remains to keep your health as good as possible for as long as we can.
If I choose DNR, can I change my mind later?
Absolutely. Code status decisions can be changed at any time.
I have not really thought about this before, and I'm uncertain what to choose.
These are hard decisions, and I understand why you'd like to think about them more. Please take time to think about this and discuss it with your partner. You don't need to make a decision today. May I make a recommendation?
Yes.
With your medical condition, I don't think you would survive CPR, and even if you did, you wouldn't recover to the point where you could travel and garden and live the way you want to live. Given this, I would recommend against CPR and a breathing machine. Please know we would continue to provide all other medical treatments and interventions. I know it may seem scary, but many individuals in your situation choose not to have CPR. While you're deciding, our default would be to put you on a breathing machine and attempt CPR were you to get that sick. What matters most is that your decision reflects what is most important to you. We're here to support you in making the choice that's right for you.
Thank you for taking the time to learn about code status. Code status conversations are deeply personal, depending on your underlying illnesses and your view of an acceptable quality of life. So there is no one-size-fits-all answer. What's important is that your choice aligns with your values and priorities. We encourage you to discuss your code status with your healthcare team so that you can continue to control your own health outcomes. At UConn Health, we're here to support you every step of the way. If you have any questions, please don't hesitate to ask.